Well, e-cigarettes have been marketed as a safer alternative to traditional smoking. They come with their own set of dangers, from lungs damage to serious explosions. The risk of e-cigarette use are real. Today we will dive into the danger of e-cigarette injuries, what causes them, and how you can protect yourself. What you learn today: the type of injuries associated with e-cigarette use, how e-cigarette affect your lungs and overall health, common e-cigarette explosion risk and how to avoid them, the long-term health consequences of vaping and e-cigarette use, practical advice on how to reduce the risk of e-cigarette injuries. By the end of this video, you will understand the risk of vaping and how to make informed decision about your health. What are e-cigarette injuries? Definition of e-cigarette injuries are: e-cigarette injuries refer to harm caused by the use of electronic cigarette or vaping device. These injuries can range from minor burn to severe respiratory issue or even life-threatening explosions. Type of e-cigarette injuries: lungs injuries. From vaping associated lung injuries VALI to long-term respiratory damage. Burns and explosion. Exploding e-cigarette device causing serious burn and injuries. Nicotine poisoning. Overdose from high level of nicotine in e-cigarette liquids. Accidental injuries, device leaking or malfunctioning leading to harm. The health risk of e-cigarette, lung damage and respiratory issue. One of the most concerning effects of vaping is the damage of your lungs. A study have shown that inhaling vaporized chemical and lead to respiratory issue including inflammation, irritation and reduced lung capacity. Some people have even experienced chronic lung disease or pneumonia like symptom after prolonged use. Vaping associated lung injury. VALI is a severe lung condition that has been linked to vaping. It involves inflammation and scarring of lung tissue, causing symptoms like coughing, shortness of breath, and chest pain. These conditions have been reported in several countries and is primarily associated with illicit or black market e-cigarette product. Nicotine poisoning. Nicotine poisoning is another risk, especially for young people. E-cigarette liquid are often highly concentrated with nicotine, and accidental ignition or overuse can lead to symptoms like nausea, vomiting, dizziness, and in severe cases, serious or death. E-cigarette explosion. One of the most shocking risks of e-cigarette use in the possibility of the device exploding. These explosions occur when the lithium ion battery inside the device malfunction or are improperly charged. E-cigarette explosion can cause serious burn, facial injuries and even blindness. Cause of e-cigarette explosion. First is battery defect. Faulty or damaged batteries that overheat. Overcharging. Leaving device plug in for too long. Improper storage. Keeping e-cigarette in extreme temperature or exposed to moisture. Pre- Precautionary measures. To reduce the risk of explosion, always follow manufacturer instruction for charging. Avoid using damaged device. and ensure that your e-cigarette is stored safely away from heat or moisture. Long-term effect of e-cigarette use. First is chronic health risk. Well, vaping may seem less harmful than smoking. The long-term effect of e-cigarette use are still not fully understood. However, there are several studies indicating that regular vaping can lead to chronic conditions like heart disease, lung disease, and even cancer over time. The impact of chemical in e-cigarettes. E-cigarette vapor contains harmful chemicals like formaldehyde, acetaldehyde, and acrolein, which are known to be toxic to humans. These chemicals can damage tissue, irritate the lungs, and contribute to disease like chronic obstructive pulmonary disease (COPD). Risks for young people. The impact of vaping on teenagers and young adults is especially concerning. Nicotine use during adolescence can affect brain development, leading to addiction, memory problem, and difficulty concentrating. How to protect yourself from e-cigarette injuries? Avoid e avoid buying e-cigarette or unregulated product. To avoid injury and health risk, always buy e-cigarette and vaping product from reputable source. Illicit or black market products are often unregulated and may contain harmful substance or faulty batteries. Proper charging and storage. Always follow the manufacturer instruction for charging your device. Don't leave it plugged in overnight and avoid using damaged battery. Keep your device in a safe, cool and dry place. Consult health professionals. If you experience any health issue related to vaping, including coughing, shortness of breath, or chest pain, make sure to seek medical advice as soon as possible. Your doctor can help you determine if the injury is related to e-cigarette use. Consider quitting. The best way to avoid e-cigarette injuries is to quit vaping altogether. If you are struggling to quit, there are many resources and programs available to help you, including nicotine replacement therapy and counseling. E-cigarette injuries can range from minor health issue to life-threatening explosion. While vaping may be seen as a safer alternative to smoking, it is important to recognize the risk and take preventive measures to protect your health. If you found this video informative, please give it a thumbs up and share it with others who might be considering vaping. Let us know in the comment if you have experienced any issue with e-cigarette, and don't forget to subscribe for more health related content. Thanks for watching. Stay safe and take care of your health.